Spring flowers are emerging after their long winter lockdown. And today, a sign that we might soon be able to open up as well. The latest numbers from the REACT study, an England-wide survey of COVID infections, are far better than expected.
It is nice to be able to report good news today. So from the study last month, we've seen a really substantial fall. So it's gone down by 2/3 from the level that we measured during January. The trend is very good news, but with the number of people in hospital still very high, similar, about the same level as the peak of the first wave, there isn't that much headroom.
Declines in cases have been highest in London, but the picture is less positive in the northwest, Yorkshire and Humber, and here in the northeast. But the slower decline in some regions may have less to do with where you live than what your circumstances are. Something that a government determined to ease lockdown just weeks from now knows it can't ignore.
We've seen through this whole pandemic that it's affected different communities, and we've seen higher rates in some areas and for people with some occupations. And I think it's really important, as we have the vaccination programme, that we are vaccinating those who are most at risk of death.
In the latest data, the average infection rate across England is around 1 in 200 people, but the rate is nearly twice that in those who live in deprived areas and 4 times higher among those living in large, often multi-generational households and in people of Asian ethnicity. Age is a factor too, with rates highest in 18 to 24-year-olds, with 5 to 12-year-olds close behind. And that makes some experts nervous about the reopening of schools in just over 2 weeks' time.
We're seeing substantial drops in case numbers. I think what's very important at this point in time is that we don't sort of squander these gains, because people have made huge sacrifices for us to get here. And the real worry is that if we do open up schools at this point in time, despite looking at the figures, we will very quickly end up with surges in transmission are going above 1.
Some schools, like this one in London, are using lateral flow tests to reduce the chances of outbreaks. But as it prepares to publish its plan for easing restrictions next week, opening schools is just one of the many challenges government faces. It can't risk taking us back into lockdown, especially as we begin to embrace new and hard-earned freedoms. Tom Clark, News at 10.